Now to our earlier story about the price we pay for prescription medicines. A campaign launched today from 3 consumer groups argues we pay too much and should be demanding cheaper prices. Here's some of our earlier interview with Alan Kirkland, the CEO of Choice.
And you have a situation where pharmacists are buying the medication at a lower price, but they're still getting compensated by the government at a higher price, and we're all effectively funding that gap. In some cases, pharmacists are getting 70-80% more than what it's actually costing them. And there's a very sensible measure that was introduced by the Howard government in 2007 called price disclosure. It's a pretty easily defensible mechanism that says that the government needs to know what the price is that pharmacists are actually paying. Mm-hmm. And there's been a recent announcement to make that all happen much quicker, so that the period from when the price drops for pharmacists to when the government can negotiate a lower price gets much shorter. So that means there's more money available in the PBS, which means hopefully more medicines can be listed and we've all got better access to affordable medicine.
That's Alan Kirkland, the CEO of Choice, speaking to us earlier. Choice, one of those 3 consumer groups launching this campaign today. David Quilty is the National Executive Director of the Pharmacy Guild. David, good morning. Welcome to Breakfast.
Good morning, Fran.
David, what's your response to that claim there from Alan Kirkland? But basically, chemists are buying pharmaceuticals from the manufacturer at a low price, but getting reimbursed by the government at a higher price. Is that true, and why should that happen?
It does happen for a short period of time, Fran, after medicines come off patent, and that is taken into account in the agreement that we have with the government. In fact, in their agreement, pharmacists are providing $1 billion of savings to taxpayers. So, yes, to an extent it does happen, but it is fully taken into account in our agreement with the government.
I'll come back to that agreement, but the other claim from the 3 consumer groups is that Australians are paying up to 10 times more than the British price, for instance, for the same prescription medicine. Do you accept that's happening?
Well, I think that the consumer organisations have selected a small number of medicines at a particular point in time.
Well, whether it's a small number or not, are there some? I think Alan Kirkland told us earlier that one of the statins was one of them, which is, a lot of Australians use this kind of drug.
In terms of the consumers themselves, of course, they pay the concessional co-payment, so it doesn't affect them per se. In terms of taxpayers, as Alan indicated, there is a very effective mechanism called price disclosure to ensure that the taxpayer pays the same amount that is paid in the market over time.
But that's what all this is about, this campaign, isn't it? That the Labor government, just days before the election, wanted to shorten that price disclosure period from 18 months, where it currently is, to 12 months. And that's what the chemists are taking exception with.
We're not taking exception with the reduction in the time frame. We're strongly supportive of affordable medicines, and for 7 years now we've supported price disclosure. However, what needs to be recognised is that price disclosure does have a flow-on impact for pharmacies. That has been recognised in our agreement previously, and what happened here was that without any consultation, the goalposts were moved, and hence there is a greater impact on pharmacies. We're not actually asking for this price disclosure change to be reversed at all. We're simply saying we need to have that flow-on impact recognised, because it is significant and it's likely to impact on jobs and also patient services.
So you are asking for some extra industry assistance, an industry assistance package to add on to the deal you already have with government?
We're asking that the agreement that we have with government be honoured. In terms of the savings that the government is looking to get from this change to price disclosure, in the economic statement, they calculated at about $2 billion and $835 million specifically from this acceleration. We're simply asking that the flow-on impact from this, which we calculate at about $149 million, that be provided to pharmacy so that it offsets the negative impact. It is that middle ground that you talked about in your earlier interview, Fran.
So wouldn't consumers listening to this, though, think, well, why should the pharmacists be getting that $149 million? I mean, if there truly is an extra period here of 6 months that can be cut off, where the window is there for the chemist to make, as we heard earlier, 70 to 80% margins on some of these PBS medicines, why should they be getting that? Why shouldn't I be getting, as quickly as I can, access to cheaper, affordable medicine? Because we know that's a real problem for many Australians.
Look, we have absolutely no issue with taxpayers getting value for money, and if government chooses to more quickly reduce the price that it pays for medicines, we have no difficulty with that whatsoever. In fact, we've supported that for a number of years. All we say is that we need to recognise that in terms of the pharmacist, they have particular costs in terms of dispensing the medicine safely and providing the advice and other services to the patients. And we need to make sure that those costs are also taken into account.
But aren't they already taken into account? I mean, we heard earlier Carol Bennett from the Consumer Health Forum says that's already $3 billion a year from government to cover those dispensary costs and other costs. Do you dispute that figure?
Well, that is a total amount of money that goes to the whole pharmaceutical sector.
And that's to cover those dispensing costs. Those costs won't change simply because the time limit changes, will it? Will they?
There is a direct flow on. So if they reduce the price that the government pays for medicines, yes, it reduces the amount that the pharmacist gets directly in terms of their markup and hence their dispensing fee. So it does have a direct flow-on impact.
What are I know the chemist shops have a petition, many of them now, saying that if these changes go ahead as planned without some kind of compensation package, basically is what you're explaining to us, for the chemists, then some local community pharmacies will close. What's your estimation? Have you done some sums on this? How many would shut and when?
Well, to give people a bit of an idea, pharmacists were already facing a reduction of about $60,000 next financial year because of the existing price disclosure regime. And that was taken into account in our agreement with the government. So tough times were coming for pharmacy already. With this latest change, we calculate that its impact is an additional $30,000 next year, so a total of $90,000 on average per pharmacy. And when you look at how much a pharmacy makes in a year, the median profit for a pharmacy in terms of our latest calculations is about $140,000 a year. So this is a very significant hit, and it's clearly going to have an impact on jobs and on services. And unfortunately, in terms of some pharmacies, it's really going to put their viability at risk.
Just finally, and I'm sure this argument will go on through this election campaign. It's now sort of come into the election sphere. Just back to that price of why it is that Australians pay more for our medicine than people do in New Zealand or Britain. Because again, Choice, ACOS and the CHF say if we paid the same prices as New Zealand for our medicines, we'd save $1 billion a year. What should the government be doing to make sure consumers get their medicines at the same price as people in New Zealand and Britain do?
Well, there's a couple of points here. In terms of how much the taxpayer pays for medicines, it depends very much on when they come off patent. In a comparison between Australia...
Yes, but the patent's a global patent, isn't it?
No, they come off patents at different times, and in the UK they came off patent in terms of the drugs that the consumer organisations are talking about much earlier. In New Zealand they have a particular system where you have no choice. They have a tendering arrangement where all patients have to purchase the same medicine. So there's absolutely no choice. And that can run into other difficulties in terms of a lack of access to medicines. If patients are used to using a particular brand and then suddenly are forced to go to another brand, the impact that has on their compliance and the like. So I think we have a pretty good balance here, and we have no issue with price disclosure. It is reducing the price of medicines down. Some medicines have already gone down by about 80%. The important thing here is as we do that, let's make sure that pharmacies continue to be paid for the important work that they do.
Okay.
So, thank you, Fran.
David Quilty, thank you so much for joining us.
Thank you very much.
David Quilty is the National Executive Director of the Pharmacy Guild. It's 8:45 on Breakfast.